Let's take you live now to the Chief Medical Officer, Paul Kelly. He's just declared Greater Brisbane a hotspot in relation to COVID.
Safe behaviours, those simple messages we've been giving everyone for a year. This virus has not gone away. It is circulating, we know, in the Brisbane area at least, and so people should be taking those precautions of the COVID safe behaviours that we've been saying all the way along. Keep your physical distance, remember your cough etiquette, wash your hands often. All of these things remain important. For those that are in the Brisbane area or have previously and recently been in Brisbane, please take note of the now large number of exposure sites that have been discussed and made available for contact tracing purposes in Brisbane, the Greater Brisbane area. There are over 60 now, and also for take note of what your local health authority is saying in relation to that. All states and territories now have particular advice for people that have been in Brisbane in recent times. Finally, just a quick note on the vaccine rollout. Yesterday we had our record number of vaccines. 55,597 vaccines were put into arms right around Australia in that 24-hour period, which makes the total of 597,523. So a real shout out to everyone that's been involved with that vaccine rollout, whether they're the people producing our own vaccines in Melbourne, those involved with the distribution of the vaccines, those in GP surgeries, GP respiratory clinics, aged care, InReach, the Aboriginal Community Control Sector clinics, and our state and territory partners for getting this vaccine out and being administered to people. This is the way that we are going to be able to get out of this pandemic, but we're in the early phases of that rollout, and going forward we'll continue to see that assist in these matters. So Claire, thank you for coming. We'll go to you first.
I have a couple of questions. Firstly, with regards to the state rolling out of Phase 1A, we know that most states have barely managed to get over half of their allocation so far into people's arms. What exactly are your state colleagues telling you that the hold-up is? Some states like Queensland are claiming that it's because they need to hold second doses. We know that's not the case. Why is it so slow at their end?
So look, I have to say that we have a fantastic partnership with the states and territories, and that's working very well and has done from the beginning, and that's that. I'm not going to call out any particular state or territory in this regard. We are working very closely together on this massive logistic exercise. I will make one point though, and I recognise that this has been said differently in other press conferences today, but from the beginning we've been very clear from the Commonwealth how much vaccine is coming in and how much is being distributed to the places where the vaccine can be given, including each state and territory. We've been very clear in relation to the Pfizer vaccine, because the second dose needs to be given 3 weeks after the first, the Commonwealth, as part of our responsibility, will be keeping a second dose available for every single person that gets a first dose. There is no need for a state or territory to be keeping any vaccine aside for that purpose. That's the Commonwealth's responsibility. In terms of the speed of the rollout in the states and territories, up until very recently, we've all been in the boat of having a limited supply. It's been shared around to the states and territories, now to GPs, GP respiratory clinics, and our InReach teams into aged care and disability care. And we are getting those out the door as quickly as we can, getting it out to those places where the vaccine can be given. And so we're encouraging all of our partners, once that vaccine is there, to make bookings available to people so they can come, starting with those priority groups, 1A and 1B. That's the phase we're in at the moment.